you're beginning your study of the upper limb. The upper limb is filled with muscles, many muscles. All have different names. You will have to learn the names of all of those muscles. All those muscles receive muscular innervation. You will have to learn the names of the nerves that innervate all those muscles. You can, if you take this approach that may have worked in undergraduate school, make lists of muscle names and next to it the list of the nerve that innervates them. But that would be a very foolish way to approach this. I'm not going to stop you from doing it if you want, but you can. There is a pattern. There is a pattern to the way the muscles of the upper limb are innervated. And if you learn that pattern, and that's pretty much all I know is the pattern, with a few exceptions, because there are always a couple of exceptions to every pattern in the world. If you learn this pattern, you will be able to, quote-unquote, deduce the innervation of most of the muscles of the upper limb. You're going to have to remember a few. That's just the way it is. But most of them you'll be able to deduce the innervation for. Now, the pattern is a pattern that's laid down in the evolution of human beings from, starting way back from lobe-finned fishes up through salamander-like type creatures, up through lizards, up through four-footed mammals, and then monkeys and apes, and through humans. So even though the pattern can be explained in a minute or 30 seconds or a minute, and I will do that at the end of the lecture, and that's really the only part of this lecture you really have to stay awake for, the first 44 minutes and 30 seconds are going to be explaining how the pattern came into existence, because you're all getting graduate degrees, and you should know how this happened, more not just what the end stage is. And this, I'm going to show you a video. This video was created by a man named Daniel Lee. Daniel Lee is an artist, quite a well-known artist, and his son, Y. Lee, was a student here 7-8 years ago, and Y is now a resident in urology here at Stony Brook. I showed this without knowing his father had created it, and he came to me after and he said, my dad did that, my dad did that. And it was astounding. His father sent me a very high-resolution image of the video and a book and everything. It's really impressive. There. To me, that's phenomenal, absolutely phenomenal. And what we're going to go through here is, with even better drawings I made myself, starting with this one, about how it is that the human upper limb came about from starting at this stage, and how the pattern for the innervation of our musculature was laid down in this lobe-finned fish. You know, there are lobe-finned fishes, which today I think are coelacanths and latimeria and polypterus and things, lungfishes. And there are ray-finned fishes, which are the kind we eat. All right? And those fish really are often in a different plane, a different branch than the ones that gave rise to four-footed lizards and mammals and things like that. So we start with a lobe-finned fish. Now, lobe-finned fish, as all fish, even the ray-finned fishes, have a fin up here towards the head called the pectoral fin, and a fin at the back towards the tail called the pelvic fin. We are not interested in the pelvic fin today because that will evolve into a lower limb, and there will be a separate lecture on that. We're only interested today in the pectoral fin, which will evolve into an upper limb. Pectoral fin has a fairly well-defined cranial edge, that is an edge that faces the head, and that is called the preaxial border of the fin, and a well-defined edge which faces the tail, and that is called the postaxial border, because the axis of the fin runs right down the middle, so that's the border in front of it, preaxial, and the border behind it, postaxial. Interestingly, this border, called preaxial, faces the head, as I said, which means it is also could be called a cephalic border. And there's, in fact, a vein which runs along that border called the cephalic vein. And that's the very same cephalic vein that we have, and it got its name because it runs along the preaxial or cephalic border of the embryonic limb. If we take a, sort of a transverse section, it is a transverse section, through the fish and its fin, we'll see something like this. This is highly schematized. Here's the vertebra of the fish, but here is that pectoral fin sticking out from the side, and it's got some bones in it, that run down the axis of the fin, and the most proximal of those bones, this one right here, articulates with a bony element that's in the body wall, in the trunk wall, which is called the girdle. So that bony element is the pectoral girdle sitting in the trunk wall, and it articulates with the most proximal of the bones in the actual fin itself. The pectoral girdle in fish and in all creatures after fish develops from two separate ossification centers. We talked a lot about ossification centers yesterday, and I'm sure you heard a lot about them when you did the skull. There's a separate ossification center for a dorsal part of that pectoral girdle, dorsal being, because here's the vertebra, so dorsal's up at the top there, and a separate ossification center for the ventral part of the pectoral girdle. And the dorsal one is called the scapular ossification element, and the ventral one is called the coracoid ossification element, and the whole thing is the pectoral girdle. And where those two elements meet, there's a little articular cavity called the glenoid cavity, and it is in that glenoid cavity that the most proximal bone of the fin actually articulates. The glenoid cavity is formed by a contribution from both the coracoid and scapular ossification elements. The muscles of the fin are divided into two groups, a dorsal group of muscles and a ventral group of muscles. And it's pretty much all a fish has to do with its fin is flopping up and down. It doesn't do a lot. And the dorsal group of muscles, which flop it up, arise from, many of them, from the scapular ossification element. And those that don't arise from the scapular ossification element lie jumping from bone to bone along the dorsal aspect of the fin. And the ventral muscles, those primarily which flop the fin down, many of them arise from the coracoid ossification element, and those that don't run from bone to bone along the ventral surface of the fin. So it's pretty straightforward. You got dorsal muscles and ventral muscles of your fish fin. If we take a section through the actual fin itself, you see the bone which runs down the axis of the fin at whatever level I've taken this. I'll take it up high near the base. So that'll be the proximal bone. And then we see a block of orange things, which are the dorsal muscles on the dorsal surface of the fin, and blue things, which are ventral muscles on the ventral surface of the fin. This is a section. I only put this section in because you should have seen this before. It's a section through an embryo. Here's the heart down there, and head. I know you don't do embryology, but Dr. Larson, I'm almost certain, showed you this picture when she talked about organization of the nervous system. She talked about an epiaxial dermamyotome, which gave rise to all of the dorsal ramus innervated musculature of the body, and a hypaxial dermamyotome that gave rise to all the ventral ramus innervated muscles of the body. She may not have mentioned this stuff here called lateral plate mesoderm, and I'm not going to try and teach you embryology today, but it's there. And this is the heart that we saw. The neural tube and the vertebrae, you should know. Here's that same picture, but I'm pointing out now this thing right here. This thing is, in fact, the beginning of the upper limb of the human being. It is called the upper limb bud, and it pretty much looks like a fin of a fish. And if we take a section that way, catching the upper limb bud in our section, it looks just like this, except I'm going to carry you through its development. At first, it is an outpocketing of the outer layer of the embryo that happens to be called ectoderm. And that outpocketing of the ectoderm gets filled with some cells which migrate from this thing I called lateral plate mesoderm into it to fill it up. And when you ever have a loose collection of mesodermal cells, the name for that is a mesenchyme. So this is called the limb bud mesenchyme. That's what fills the outpocketing that is destined to become the upper limb of a human. From that limb bud mesenchyme, the bones will form, and within the lateral plate, the pectoral girdle will form. These cells, first they make cartilaginous precursors of the bones, and those get converted into osseous elements. So these bones in the free part of the fin, of the upper limb rather, are derived from limb bud mesenchyme, and the girdle elements derived from the lateral plate mesoderm. And even in an embryonic human, there will be, once it starts to ossify during fetal life, a separate ossification element for the dorsal part of the girdle, and a separate, called the scapular ossification element, and a separate one for the ventral part called the coracoid ossification element, and they will meet at the glenoid, and that glenoid will be where the proximal bone of the future limb articulates, which you know is called the humerus. There's no muscle in this at this point in development. There's just bones, some undifferentiated mesenchyme, and the covering ectoderm. What's going on? This is just jumping way ahead to an adult, because I told you there were these two elements of the pectoral girdle. Those two elements are very clearly identifiable in the adult scapula. Most of the adult scapula is derived from the scapular or dorsal ossification element. A small portion of the adult scapula is derived from the coracoid ossification element. It is just a peculiarity of nomenclature that we call this whole thing the scapula. We really should call it the pectoral girdle. But I don't know what historical accident caused humans to call this entire bone the scapula, when in fact only the orange part is really the homologue of the scapular ossification element of fish. And the blue part is the coracoid ossification element. They meet in formation of the glenoid. But going back to this, now the muscles are going to invade our limb bud. And the muscles are all derived from hypaxial dermamyotome cells, and they will migrate into the limb bud, and all of the striated muscle will be formed from these hypaxial dermamyotome cells, which tells you right off the bat that every muscle of the limb has to be innervated by which ramus of a spinal nerve? Ventral. Right, thank you. Ventral rami do all hypaxially derived muscles. Dorsal do all epaxially derived muscles. If all of these come from hypaxial, they're all innervated by ventral rami. You never have to worry about the dorsal ramus innervating any muscle of a limb. So they migrate in there, and then these cells take up a position, dorsal to the axial bones and ventral to the axial bones. And they really can be identified as a developmentally and evolutionarily dorsal group of muscles will form, and a developmentally and evolutionary ventral group of muscles will form, just like in our fish's fin. And as they start to differentiate, some of the dorsal muscles will arise from the scapular ossification element, and the rest of them will run on the dorsal surface of the bones, and some of the ventral from the ventral ossification element or coracoid, and others will just run along the ventral surface of the limb. So it really is. I mean, there's hardly anything better. I mean, maybe the neck is better. Who was the phylogeny, ontogeny recapitulates phylogeny? Haeckel? Haeckel. Good. People who actually have a historical understanding here. Ontogeny recapitulates phylogeny. You must have heard this before. It means that during development, the embryo and fetus go through stages which replicate what happened in evolution. Now, of course, we know that isn't exactly true anymore, but it doesn't make you convinced if it's exactly true. It's roughly the case for some things, and for the limbs, it is very close to the case. Our upper limb goes through the evolutionary stages that occurred for the last 400 million years. So, we had the fish, and then the fish, at some point over time, will evolve into a tetrapod, a salamander looking like tetrapod. Tetrapod just means four-footed animal. All right. So that means this pectoral fin's got to turn into that thing, which we can call the pectoral limb, if you will. Not a fin anymore. I did call it the pectoral limb. All right. So it's got the preaxial border, just like the fin did. It's got a postaxial border, just like the fin did. It's got segments, though, that the fin never had, because the pectoral limb is divided into segments. And the first segment is called the arm. Now, anatomists call it the arm. Clinicians call it the upper arm. And I almost always try to call it the upper arm, even though that's not the proper anatomical term. And it's very obvious why clinicians call it the upper arm. It's because the word arm in everyday common usage means this whole thing. What we know is called the upper limb, everybody in the world outside of this room will call the arm. All right? So if you have a patient comes in to you and says, oh, doc, I hurt my arm, you don't know if they really mean the proximal segment of the upper limb. They can mean anything. So clinicians who try to talk in a way which is less confusing will say, this is the upper arm, and then you absolutely know what you're talking about. You don't have to guess whether you're using it as a colloquial term, arm, or an anatomic term, arm. But the anatomic term is arm for the proximal segment of this pectoral limb of our salamander. And it's got a bone in it, a single bone called the humerus. And that humerus articulates in the glenoid of the pectoral girdle at what's called the shoulder joint. And then it's got a second segment called the forearm. Everybody uses the word forearm, so it doesn't pose a problem. And the forearm has two bones in it. One is a preaxial bone called the radius. It's on the preaxial border of the limb, or near the preaxial border. And the other is a postaxial bone, or bone near the postaxial border, called the ulna. And those are the bones of the forearm. And the joint that they form with the humerus is called the elbow joint. Then there are a bunch of little bones distal to the forearm and in a region of the limb that we call the wrist. And those little bones are called carpal bones, and they vary in number from creature to creature. And they form with the forearm, the wrist joint. And then within the digits, now we didn't have digits when we had a fin, but we do now, we have 5 digits. And within the digits, there are bones as well. Of course, the things which house the digits and the part distal to the carpal bones is called the hand, or manus. And the preaxial digit tends to be bigger than all of the other digits, and that is called the pollex, or the thumb. I mean, the pollex is synonymous with thumb in human beings. So that is the preaxial digit of our tetrapod hand, the bigger one, the biggest one. There are bones. The first bone of every digit is called the metacarpal. That's in the palm of a human hand. And then the free parts of the digits, they have phalanges in them, but you'll learn more about hand bones later. So that's the tetrapod limb. If you do a transverse section through it, it's going to look like this. There's going to be a pectoral girdle with a scapular and coracoid ossification element forming a glenoid. The humerus, the bone of the proximal element, the arm, articulates at the glenoid. And then there are the 2 bones of the forearm articulating at the elbow. And then the wrist region with the carpal bones. And then the digital region with metacarpal first and then phalanges after. Any muscle which arises from the scapular ossification element is a developmentally and evolutionarily dorsal muscle. If it lies along the dorsal surface of the limb, it's a developmentally and evolutionary dorsal muscle. But some of them actually that attach here to the humerus migrate and gain an attachment from the vertebral column. So that's something new that happens in tetrapods. There's some migration of muscle cells having gained an attachment to the humerus that migrate up and gain an origin from the vertebral column. And on the ventral side, anything that arises from the coracoid ossification element is developmentally and evolutionarily ventral. If it lies on the ventral surface of the limb, it's ventral. And some of those which attach to the humerus, cells migrate and gain an origin from the sternum. So that's a different. These migratory muscles to the trunk is something new that occurs in tetrapods. If we take a section through the arm of our tetrapod, our primitive tetrapod, it's still going to look exactly like the one through the arm of a fin of the fish. There's no difference here. Central bone, dorsal group of muscles, ventral group of muscles. Now, the tetrapod is going to turn into a mammal. Salamanders and even most lizards, they walk like that, all right? And their bellies are sort of on the ground, all right? And their arms are stuck out to the side like this. Mammals, in the evolution of mammals, the limbs have come underneath the trunk, elevated the trunk from the ground. And that's what we're showing here, the limbs coming underneath the trunk. Now, if I were to just do this, okay, I want to be a mammal, and I bring my limbs like that, obviously I'm not going to get anywhere because they're going to hit one another every time I try and move them. So I have to rotate them, and that's what I'm going to show you now, and this occurs during human embryogenesis and occurs during evolution as well. So first let's take our primitive salamander-like tetrapod picture we saw before, and what's going to happen during evolution and during human development is the pectoral limb or the upper limb is going to rotate as you are looking at it now, counter or anti-clockwise. It can be a genuine rotation, developmental or evolutionary, depending on which thing you're concentrating on. And that's going to happen as this thing becomes mammal-like. And when that happens, that 90-degree rotation, you can see the important change is that what were muscles were called dorsal muscles no longer face the back. They now face the tail. They're on the caudal surface of the limb. And the muscles that we called ventral muscles no longer face the belly. They now face the head, and therefore they are in the cranial segment of the limb. There's a rotation, so the preaxial border faces dorsally. All right? And what was dorsal now is caudal. What was ventral is now cranial. And then the limb is brought underneath the creature, and that is what lifts its belly off the ground. So we were like this, rotation, and then the limb is brought underneath, and now the limb can go back and forth without banging into each other. Again, this is the dorsal muscles are now on the caudal surface of the limb, except they're on what would in fact be called the dorsal surface of the manus because it's bent here. And they're on the cranial surface of the limb, except what would be on the ventral surface or the palmar surface of the manus or hand. Now, this does not occur in a step. It's not that in evolution or in development, you get a rotation first, and then the limb being brought underneath. This occurs as a continuous sort of event because the limb has to be operable at every stage in evolution. Yeah. Go ahead. Now that is so good for you. It's almost as if you saw the next slide, which is why does the hand point posteriorly there? And the hand points posteriorly there because when you do the rotation and you bring the limb under, the hand points posteriorly. But you're smart enough to know that no animal can run that way. And no animal does, no dog or cat or horse or I'm trying to think, or monkeys, but I'm trying to think of pomegranate animal. No animal can run that way with something like that. So what mammals do, all mammals, is they pronate. This is not an evolutionary, it's not a developmental change. It's a simple, they're like this, and they simply twist. And it's just a motion. It doesn't involve any repositioning of anything evolutionarily or developmentally. It's just a twisting of the arm so the fingers point forward. So that's really what, and so there has to be a crossing of dorsal muscles from the caudal surface as they cross over to get to their position on the dorsal surface of the manus this way. All right, so I've showed you how that happens. What's going to happen? So we go from here, which was our primitive tetrapod, rotation, limbs being brought under. Now, human beings are not four-footed animals, so I'm not going to do the pronation because we don't have to run on our hands. I'm just going to stand up. And that's exactly the anatomic position. You just have a mammal that does not do that voluntary pronation stand up. But look what's happened to the names of the muscles we had. When we were like this, we had the dorsal muscles on the caudal surface and the ventral muscles on the cranial surface. When I stand up like a human being and assume the anatomic position, the dorsal muscles are back on the dorsal surface. This is all nomenclatural. And the dorsal muscles are back on the dorsal surface, and the palmar are now, the ventral are now back on the ventral surface, on both sides. So it's a switch in nomenclature from what it was when I was this way to what it was when I'm standing. So you get back to the same nomenclature you had with the fish, but it's sort of artificially acquired, that nomenclature. It should have gone through the caudal cranial stage. Now, why did I spend half an hour on this? When you look at a human upper limb, you can identify in it muscles which are developmentally and evolutionarily dorsal. And there are certain nerves which go to them and will not go to any ventral muscle. And there are then muscles you can identify as developmentally and evolutionarily ventral, and the nerves that go to them go only to ventral muscles and do not go to dorsal muscles. And that pattern was laid down 380 million years ago, and it is still valid today. What happens is that in order for the nerves to get to the right muscles, you have to develop a interchange of fibers to direct the dorsal axons to the dorsal muscles and the ventral axons to the ventral muscles. And for some other reasons too, you get this interchange. And it explains the structure of this thing I'm going to tell you about, and it explains how you can deduce innervational muscles. The upper limb bud of humans arises in the neck region. That little outpocketing, which I call the limb bud, is opposite C5 through T1 body segments. All right? And therefore, it's the ventral rami of C5 through T1 which are going to innervate the muscles of the upper limb. So I've drawn here the ventral rami of C5 through T1. These ventral rami have within them some axons destined for only dorsal muscles and some destined only for ventral muscles. I'll show you them in a minute, but you have to realize that in those ventral rami, the division between axons which innervate dorsal muscles and axons which innervate ventral muscles exists within the ventral rami. But before I show you that, I'll point out to you that the first thing you'll dissect, probably from the brachial plexus, or not the first, but at some point you will, the ventral ramus of C5 joins the ventral ramus of C6 and forms the superior trunk. Now these things are happening so as to allow the axons to get to the right places and the right groups of muscles. The ventral ramus of C8 joins the ventral ramus of T1 to form what's called the inferior or lower trunk of the brachial plexus. And the ventral ramus of C7 continues all by itself as the middle trunk. So you go from roots, C5 through T1, to trunks, upper, middle, and lower. Here is the section through those trunks, indicating to you that the dorsal half, if you section one of these nerve trunks, the axons in the dorsal half will be destined for dorsal muscles. The axons in the ventral half will be destined for ventral muscles. This is an anterior view. The blue you should view as sort of closer to us, and the orange is behind the plane of the blackboard. The first thing that's going to happen is a single bundle of dorsal axons is going to leave the superior trunk, and it is called the suprascapular nerve. Now, all we know at this point is it's dorsal. So it's not going to innervate any muscle that rises from the coracoid process, that's for sure. Not going to innervate any muscle which lies on the front of the arm or the forearm or the hand. It's got to innervate a developmentally and embryologically dorsal muscle, or 2 or 3 or 4. You just have to remember which ones it innervates. It innervates supraspinatus and infraspinatus. These are muscles which arise from the scapular ossification element that absolutely specifies them as developmentally dorsal muscles, because any muscle arising from the scapular ossification element is a dorsal muscle, from fish all the way to humans. So that's what the suprascapular nerve innervates. Then all of the other dorsal axons of these trunks are going to separate from the ventral axons of the trunks in what are called anterior and posterior divisions of the trunks. The anterior divisions carrying all of the ventral axons, the posterior divisions carrying all of the dorsal axons. And at that point now, they're not going to ever come back into contact with one another. Let's follow what the posterior divisions. The 3 posterior divisions of each of the trunks join to form a single nerve bundle called the posterior cord of the brachial plexus. Since all of the posterior or dorsal nerve axons are in there, it will be responsible for innervating every other dorsal muscle of the upper limb. If you know it's dorsal because it arises from the scapular ossification element, or in fact has migrated and gained an attachment from the vertebral column, or lies on the back of the arm or the back of the forearm or the back of the hand, it will be innervated by the posterior cord, because the posterior cord is carrying all the remaining dorsal axons. The ventral axons from the upper trunk and middle trunk join one another to form something called the lateral cord of the brachial plexus. And the ventral axons, or the anterior division, which contains the ventral axons of the lower trunk, forms of something called the medial cord of the brachial plexus. These cords are named in relationship to the axillary artery. You'll see that in your dissection today. All of the ventral muscles of the body, of the upper limb, all of the ventral muscles of the upper limb have to be innervated either by a branch of the lateral cord or a branch of the medial cord, and those will not innervate any dorsal muscles of the upper limb. I'm not going to talk about cutaneous branches of the medial cord. There are a few, but that's not involved muscular innervation, so I'm just going to forget about those. Let's take a look at the branching pattern of the posterior cord, which is handling all of the dorsal muscles with the exception of supraspinalis and infraspinalis. It's got 5 branches, the posterior cord, 3 little ones, and then 2 much bigger ones. The little ones are named by me upper subscapular nerve, middle subscapular nerve, lower subscapular nerve. They are named by other people upper subscapular nerve, nerve to latissimus dorsi, lower subscapular nerve. So the middle subscapular nerve, by most people, is probably called, by most anatomists, it's called the nerve to latissimus dorsi. An advantage in that you know what it does. Clinicians call it the thoracodorsal nerve. So it's got 3 names: middle subscapular, nerve to latissimus dorsi, or thoracodorsal. Yeah, I know. What can I tell you? Clinicians almost always call it thoracodorsal nerve. These are 3 little branches of the posterior cord which are going to go to some dorsal muscles. And the dorsal muscles they go to are the upper subscapular nerve goes to a part of subscapularis. Subscapularis is a muscle which arises from the ventral surface of the scapular ossification element. But the word ventral should not be allowed to confuse you. It arises from the scapular ossification element. Any muscle that arises from the scapular ossification element is a dorsal muscle, whether it arises from the dorsal surface of that element or the ventral surface of that element. So subscapularis is a dorsal muscle. Thoracodorsal nerve does latissimus dorsi, as one of its name implies. That's a muscle that arises from the vertebral column. You saw that on the first day of lab. And the lower subscapular does also a lot of subscapularis, probably more than the upper, really. And a muscle that anybody who did the dissection yesterday saw called teres major, also arising from the scapular ossification element. So you had to memorize suprascapular doing supraspinalis and infraspinalis. You have to memorize these as well. But now we've got 2 nerves left that have to do all of the other dorsal muscles of the limb. One of them is called the axillary nerve. Again, if you were in lab yesterday, you dissected it. You've got to memorize what it does. So you're thinking to yourself, how is this helping me? I've got to memorize all that stuff. The axillary nerve does deltoid and another muscle. You should have seen teres minor. But now the memory ends. Because after that, you've only got 1 nerve left to do all of the other dorsal muscles of the upper limb, and that's the radial nerve. So if you know that a muscle arises from the scapular ossification element, or lies on the back of your upper arm, or the back of your forearm, or the back of your hand, and it's not one of these ones you memorize, it's done by radial, because the radial does all of the dorsal muscles of the upper limb other than the few that you had to memorize. As it says here. All right, now we get to the ventral muscles of the limb, the ones which arise from the coracoid ossification element, or have migrated over onto the front of the chest, or run along the ventral surface of your limb. 2 early branches, one little branch of the lateral cord, one of the medial cord called the lateral and medial pectoral nerves. The lateral pectoral nerve, if you recall from your dissection, in physical space lies medial to the medial pectoral nerve in physical space, but it gets its name because it arises from the lateral cord of the brachial plexus. And the medial pectoral nerve, despite the fact that it lies lateral to the lateral pectoral nerve, gets its name because it arises from the medial cord of the brachial plexus. They form a loop, and together these two nerves innervate pectoralis minor and pectoralis major, ventral muscles which lie on the front of the chest. After that, the lateral cord branches into two and the medial cord branches into two. And the junction, the nerve produced by one branch of the lateral and one branch of the medial is called the median nerve. The nerve which is the continuation of the lateral cord is called the musculocutaneous nerve. And the nerve which is the continuation of the medial cord is called the ulnar nerve. And these three nerves have to do all of the ventral muscles of the limb with the exception of pectoralis major and pectoralis minor. How do they do it? Here's a picture through your upper arm. It's like, see, if it's in CT view, it would be like a transverse section through my upper arm held this way. And here are a bunch of dorsal muscles and a bunch of ventral muscles. Now, you know what innervates these dorsal muscles. I wonder if I put that in here first. I did, the radial nerve. Remember, the radial nerve did all of the muscles, all the dorsal muscles, with the exception of the few we memorized, which don't even run in the arm, really. I mean, we talked about subscapularis, latissimus dorsi, supraspinatus, infraspinatus. They all insert around the top of the shoulder. So once you get rid of those, you're down in the meat of your upper arm. It's got to be radial nerve. These, there's no way to tell from what I said whether, other than these must be done either by median, ulnar, or musculocutaneous, because those are the three nerves left to do the ventral muscles. In this particular case, they're all done by musculocutaneous. Every ventral muscle lying in the upper arm is done by musculocutaneous. That's just it. Okay. Here's the forearm. Again, some dorsal muscles and some ventral muscles. What are these innervated by? Radial nerve. All right. If you don't have to know anything more, if I tell you a muscle, lies back here, extensor digitorum communis, you know what innervates it. If I tell you one here called extensor carpi ulnaris, you know what innervates it because it lies on the back of your forearm. And that's what the radial nerve does. The muscles on the front of the forearm are mainly done by median. Musculocutaneous doesn't do anything below the elbow. Musculocutaneous did the ventral muscles of the upper arm and gave up. Said, I'm going to become cutaneous after that. The ventral muscles of the forearm are done largely by the median. Largely by the median. With some done by the ulnar. Sadly. You have to memorize which two the ulnar do. The ulnar does a muscle called flexor carpi ulnaris, and it does half of, the medial half or the ulnar half of a muscle called flexor digitorum profundus. So if you ask for the innervation of a muscle that isn't the flexor carpi ulnaris or isn't the ulnar half of flexor digitorum profundus, for example, pronator teres, what innervates pronator teres? Median. If it's not one of those two I mentioned, and it's a ventral muscle of the forearm, it's done by median. So you don't need to know anything. Flexor digitorum, flexor pollicis longus. That's a muscle that lies deep in the front of the forearm. You don't know anything about it, other than it's not one of the two I mentioned, so it's got to be median. All right? Because it's just those two that the ulnar nerve does in the forearm. And then you get down to the hand. Oh, and the hand makes a little bit easier, because this is looking at you. Feel the muscles on the back of your metacarpal bones. Feel any? No. So there are no dorsal muscles in the hand normally. They do exist as anomalies of development. I wouldn't be surprised if we saw one in lab. But normally they don't. If you did have one as an anomaly of development, a little tiny muscle here that might go to help extend your fingers, it would be innervated by what nerve? Radial. Right, because all the dorsal muscles, other than the few we memorize, are done by radial nerve. But normally no one has any dorsal muscles in their hand, so we only have to worry about the ventral division nerves. Musculocutaneous has given up the ghost in the arm, so we just have median and ulnar to worry about. Median was the dominant nerve in the forearm, with ulnar just doing a little bit of the forearm. It's the other way around in the hand. Ulnar is the dominant nerve of the hand, and medium doing fewer muscles. Just here in what is called the thenar eminence, which is the fleshy part of your palm at the base of your thumb. Now, when I say median does a smaller part of the hand, that's true in the sense that it does fewer muscles, but those muscles happen to be extremely important muscles. The ones at the fleshy pad at the base of your thumb are the muscles which give your thumb the ability to move and make opposition and manipulate things. So these thenar eminence muscles, while fewer in number, are very, very important. So you can't just blow away the median nerve innervation in the hand, forget about it. On the other hand, if I named a muscle in the hand and you didn't have any idea where it lay, your smart bet is to say ulnar, because the ulnar does the majority, quantitatively does the majority of muscles in the hand. Median just does 3 or 4, 5 maybe. Here's all you need to know. First, you have to identify whether a muscle is a muscle of the limb or not, because all this pattern of what the brachial plexus innervates applies only to muscles of the limb. How do you know if a muscle is of the limb? Well, the definition of a limb muscle is it's derived from hybaxial dermamyotome cells which invaded the limb bud. That's not a helpful definition to you. Right? It turns out that all of those, with one exception, attach to a long bone of the limb. So if a muscle attaches to a long bone of the limb, humerus, radius, ulna, metacarpals, phalanges, any long bone of the limb, it is a limb muscle. You can deduce that it was derived from these hypaxial dermamyotome cells that migrated into it. There's one exception, that's the pectoralis minor. You know that arises from the coracoid process and goes to the chest. The coracoid process is not a long bone of the limb. It arises from the coracoid process in humans and in great apes and in no other mammal. In every other mammal, it attaches to the humerus. So, some things happen in the last couple of million years that give you an exception to a rule. But the pectoralis minor is a good limb muscle which has changed its origin off of the humerus, or attachment off of the humerus onto the coracoid process. But aside from that exception, it's a limb muscle if it attaches to a long bone. If you can identify a muscle as a limb muscle, you can classify it as either ventral or dorsal. It's ventral if it arises from the coracoid process or sits on the anterior surface of your upper arm or the anterior surface of your forearm or in your hand. And if you made that identification, it's either going to be musculocutaneous, median, or ulnar, with the exception of the 2 pectoral muscles. You can identify it as a dorsal muscle of the limb if it arises from the vertebral column. That's only one latissimus dorsi. The scapular ossification element, a bunch of them, lies on the back surface of the upper arm or the back surface of the forearm. There are none in the hand. You memorize about 7 or 8 of them, and after that, it's radial, does all of the other dorsal muscles. So I said, 40 seconds, 30 seconds, that's all you really need to know. What I do is tell you why it got to be there.